Greetings, friends and followers. This is Nurses Talking. I am Dale Barzy, and as always, if you like what you see and hear, subscribe, leave us a comment, and let us know what you think. So here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anybody in between. And so today I am very, very pleased to welcome April Rowe. April is a registered nurse and a freelance writer. She works in the intensive care nursery, and she's the owner of RNtoPen. April is originally from Reno, Nevada, but now she resides in South Carolina with her husband and children. So welcome, April.
Thank you for having me, Dale. I appreciate it.
And thank you for doing this. Thank you for doing this. I really do appreciate it. I've wanted to speak to nurses everywhere for a long time, and so now I have the opportunity. So thank you. I usually want to know why people are nurses. So what brought you to nursing?
Well, I think it had to do with my upbringing. I have a long line of nurses in my family, starting with, great grandma, grandma, great aunt, my mom, uncle, aunt. So I was exposed to it as a child. I think my very first job in the hospital, I was in nutrition services, passing out trays to the patients, and then I ended up doing phlebotomy. And when the first time I walked into the NICU, like my heart just fluttered. And at that moment, I knew, I was like, I want to be a NICU nurse. So that kind of set me on the path to going to nursing school and getting it all done.
Yeah, that's awesome. So having had all of these people, so many generations before you and around you who were nurses, um, when you actually became a nurse, I have two questions about that now. How do you
Mhm.
think nursing for you is different to how it was for your great grandma, say?
Oh.
And yeah, let's start with that one.
Well, my great grandma, she was trained at St. Luke's Hospital in San Francisco, California. I can't remember where exactly, but
Hmm.
her training was all in the hospital training. So that's a big difference.
Hmm.
And I know with my mom, I used to steal her little cap, and she'd have her cap and uniform, and same with my great grandma had that too. And I remember them wearing it. And
Yeah, 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 yeah. I ask that because I have been a nurse now, this month of May, made it 49 years. There have been a lot of changes, and I've worked in different places too, in different countries. So, um, what's expected of a nurse in one place is just not the same thing in another place. Anyway, but the changes that have taken place over those 49 years have been massive, really, as far as nursing goes. Um, Changes in terms of how you're paid, how you're perceived, what you wear, what you're expected to do and know, and all of this kind of thing. So
Mhm.
that's huge. That's huge. And so my second question to that was, once you did become a nurse, was it what you expected it to be?
I think yes, it was. Although it was harder than I expected. I didn't
Hmm.
realize, how much goes on in that shift.
Yes.
And I think that, and I was a CNA too before I became a nurse, which being a CNA is an extremely difficult job.
Yeah,
I
it
worked
is.
very hard. And but the pressure you feel as a nurse, like it's hard to describe. You come home from your 12 hours and there's so much that goes on in that, but like the overstimulation and
Yeah.
there's
Hmm.
this weight, nurses have a weight on our shoulders that you don't
Yeah.
have because you're taking
Yeah.
care of someone. It's someone's life is in your hand, and that's a lot of pressure. And I think that's why we're so tired after working, because
Yeah.
it's a big
Yeah.
deal, a lot of responsibility.
Yeah. 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 And you know that is actually, I'm glad you articulated that, because that is actually one of the goals of this whole channel, is that apart from wanting nurses to see nurses, I do want our consumers, people we serve, to have a little bit better insight into who we are. Because I think that they think what we thought, or at least what I thought when I decided to become a nurse, is that I was going to be caring for people. And yes, I am. But there's so much more to it than you see.
Yeah. It
Yeah.
takes a lot of, organization and thinking and planning and getting interrupted constantly and having to get right back into what you were doing. It's a lot all
Yeah,
at once.
yeah. And discipline is a big, oh my goodness.
Mhm. Yeah.
Yeah. So NICU is the only place you work, is the only area you work?
No, I did NICU for 10 years and then I wanted to get a better schedule because my kids were young and I was missing all
Um,
the Christmases and
mm-hmm.
weekends. So I thought I'm going to change it up and I went into it was outpatient endoscopy and then I did hospice. So I loved hospice, but that got pretty draining and the on-call's pretty heavy and you're always
Yeah.
called out at night multiple times. Um, and there were pediatrics that I did with that as well. And then I did pre-surgery admission, which was super fun. That's kind of a little secret
Mm-hmm.
area that I don't think a lot of people know about. What a
Mm-hmm.
great gem of a nursing job that is. And then I moved across the country, so I had to leave that job and I did home health for a year, which is very challenging. It's like, I think people think home health is easy and it's not. It's a challenge.
I tell
But
you,
I'm
I
a,
have, mm-hmm. Go
I'm
ahead.
a better I'm a better clinician after that because you really have to have skills to, put those catheters in that environment or do dressing change. There's a lot you do, and it was a good experience.
I have to tell you, I have the greatest respect. I have the greatest respect for nurses, period. But I have the greatest respect for home care nurses. I do. I lasted one day. I did one day and I said, this is absolutely not for me.
Yeah, it's either for you or like because you have to go into their home and their environment, and it's the way that it is, and you have to accept
Mhm.
it and
Yeah, yeah,
see a
yeah,
lot of
yeah.
interesting things.
So having worked in so many diverse areas, worn so many hats, um, what would you like to see change, if anything, in nursing?
I think one thing I found, like in the hospital setting, or really anywhere, is the matrices that they use. They use those fancy little
Yeah,
matrix that dictate how your day is going to be.
yeah,
And I don't understand those, and I really don't like them.
yeah,
I think it's
mhm,
unfair to the nurse and the patient when, oh, well, it's in the matrix, we're good, but it's too many patients or too
yeah,
many high acuity, and I'd like to see that change.
yeah. I'm so happy that you mentioned that word, acuity, because I remember it just took me right back to an incident a few years ago, when I still actually worked full time, to an incident that occurred. And I had a discussion with an administrator about, the incident, and she, you know, literally just threw out the word, well, the acuity was, and I'm like, so did you even understand what the word means? And I realized in saying that a lot of people who delegate and who create these matrices and stuff like that and talk about stuff like that really don't understand what they're talking about.
Mhm.
So, so
It's like a
I'm,
snapshot of a patient, but there's so much more involved, like the family. How
yeah,
much time you have to spend with the family? That's certainly not in any
nowhere,
acuity,
nowhere.
so that can be very time consuming and
Yeah,
take you away from all the tasks you have to do. And
yeah,
so it's
yeah,
just interesting. Yeah.
yeah. And in taking care of the patient, you do have to take care of the family.
Mhm.
You do have to, their questions have to be answered. Uh,
Yeah.
that's another soapbox.
Yes, it is.
Anyway, so you're a writer, you're a freelance writer. How did that come about?
So I was doing the home health, and I'm really not an adult nurse in my heart. That's what I've been
Uh-huh.
saying. In my
Uh-huh.
heart, I'm NICU peds. And so I
Yeah.
became pretty unhappy in that position. And I was trying to find a way out. And I really didn't think I could go back to the hospital job. So I'm like, well, what can I do remotely? And I ended up finding, a course, and I took the course through um, the Savvy Nurse Writer, and I learned, how to do it outright that way. And so I
Mm-hmm.
started my business, and I went on LinkedIn and started getting clients, and I was writing a lot of neonatal content because that was my niche that I wanted
Yeah.
to write in.
Mm-hmm.
And I
Mm-hmm.
realized how much I miss nursing in that field. So I ended up quitting home health, and I went back to the NICU. So I do part-time NICU, day shift, and part-time writing.
That's cool. That actually is very cool
Yeah.
because, it brings you're bringing an experienced perspective uh to that. So that's great. So what kind of publications though do you write for? Do you just my question is, I guess, and for people who are looking and may want to do that, do you just pitch your articles, or do you have people who are, seeking you out to write particular articles?
Yeah, it can be both. So what I've done is I've written home health course, like mini courses for a company, and
Hmm.
then write articles for like health news. So I just do articles about all kinds of different topics, usually related to maternity, neonatal.
Yeah.
And I've done some articles for US News and World Report, and I have my newest job is managing editor of the Nurse Blake magazine that he's coming out with. So
Okay.
that's a really, really fun new venture getting
Oh,
into.
that's a new hat.
Yeah. Yeah, it's different kind of writing because I'm used to writing about a health topic. You have to research it, you have to get your sources, and
Yeah.
this is more fun. It's like interviewing, lots of interviewing of nurses, going on the Nurse Blake's cruise, which I recently
Yeah.
came back with Nurse Con cruise.
Hmm.
That was a blast. So it's very fun. It's a different style of writing, which is it's very fresh, and I enjoy it.
Hmm. That sounds like fun. It sounds like a lot of fun. And if you can
Yeah.
get paid to do it too, why not?
Yeah. And that's what I never realized. I didn't even know nurses could be writers in the first place. Never occurred to me. And then
Yes.
I never realized how everything we read, you're on your phone looking at stuff, you're getting emails, everything we read, somebody wrote it and got
Yeah.
paid for it. And I
Yes.
never dawned on me. And the fact that we're nurses and we have that credential behind our name,
Yeah.
it changes the Google authority of these pages. So it bumps them up higher if it
Yeah.
says written by April Rowe RN.
Yeah.
It benefits them and it benefits us because we should be sought out to be writing these health articles that you read
Exactly.
constantly.
Exactly. 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 And that, my dear, is another goal of this channel because I really want nurses to see that nurses are and can be everywhere, everywhere. And so that brings me to my question about burnout,
Mhm.
because, a lot of nurses are tired of this and they're so burnt out and they're just their wits end, right? First of all, having come back into it, are you still seeing it a lot?
I feel like in the NICU, there's less burnout than on the adult floor, at least
Hmm.
with what I have seen. Um, but yeah, I think and doing the writing courses and meeting people who have also created their own writing business, it's always the same story. They want something different. They want something new where you can be your own boss. And
Yeah.
I mean, most nurses can't be their own boss. We're usually an employee. And
Yeah.
so
Yeah. Yeah.
it's a whole
Yeah.
new ball game. And it's a lot of younger nurses or, nurses with families. And they're like,
Hmm.
I'm tired of
Yeah.
doing
Yeah.
hours and
Yeah.
yeah.
Yeah. Yeah. Yeah. Yeah. Yeah. And so, um, some of the things that contribute to this burnout, and I want people to see, is that um we are allowing a lot of, well, I don't know if allowing is the word, but a lot of these outside forces, a lot of these decisions that are made about us and about our careers and the way in which we work and the conditions under which we work, um, are made so much by other people who don't have a clue what we do, and is contributing in so much to this burnout that we feel. And I
Mhm.
see nurses, as I speak to nurses, I see nurses getting more and more education, stepping out into different areas and different places. And I'm hoping that because of this, we take charge more of our own profession and see a less of this frustration and burnout and stuff like that we're experiencing right now. I'm
Mhm.
hoping.
Yeah.
Yeah. Yeah. So the other thing that I really want to talk to nurses about is self-care. And I realize that it means different things to different people. What does it mean to you?
Self-care for me means taking the time to do something for myself. So I've definitely noticed now going from home health to going back into the hospital, I
Mm.
notice overstimulated I get. I
Yeah.
didn't realize it before. Maybe I've
Hmm.
changed as I've gotten older because I was in home health and it was me in my car and then seeing patients. But I get so overstimulated in the hospital setting between all the people, the alarms constantly, and the crying babies. That's something a lot of floors don't deal with is the
Yeah.
babies who there's
Yeah.
always someone crying. So it's just constant and I need quiet. And so one of the things I've recently taken up is learning how to crochet. And it's been so fun. And
Hmm.
it really like when I sit down and I'm crocheting and I'll have something playing on the TV in the background, I'm not even paying attention.
Yeah.
But that
Hmm.
has really it's done so much for me. I'm kind of shocked that I never tried picking up crafting before because it really makes a difference in my stress levels for sure.
Yeah, it does. It does. It's one of my hobbies, and so I can absolutely relate to what you're saying. It's one of
Yeah,
the things I do. I can crochet for hours
I
and
love
just,
it.
yeah,
Hmm.
and just chill down. So April, one of the things that I noticed, and I'm not quite sure exactly when I first started noticing this, but I noticed that I can recognize a nurse without anybody telling me that that person is a nurse. So I started to wonder, what exactly is it that I'm recognizing, and can other people recognize that in me? And so I started looking for words to, that describe these qualities that I see or think I see. So if you had to describe the most essential quality of a nurse, or things you can recognize would make you think someone is a nurse, in one word, what would that word be?
I think it would be being empathetic. I think
Empathetic.
huge that's a huge thing that nurses need to have is to be
Yeah.
able to interact with other people and recognize that they're going through something horrible.
Yeah.
For most
Yeah.
of us working in healthcare, we're dealing with people who are seeking out treatment for something, who rely on us,
Yeah.
who depend on, and one day we're going to be in their situation. And I think there's a lot of nurses who go into nursing as a career and I don't recommend that for anyone.
Mm-hmm.
Like,
Mm-hmm.
don't do it just to have a job and have stability and money. Like, you have to be a caring, empathetic person and actually want to care for people.
Yeah.
And I think that that's one of the big ones, is just, and
Yeah.
people who've never, if you've never lost a family member yet, if you're young and everybody's still alive and you're young and healthy and you've never had to be exposed, you've never had kids before and had your legs open, there's people who don't understand what it's like to come in as a patient. And it's like, one day that's going to be you, one day it's going to be your family. And you want to hope to have a nurse who's caring and empathetic and
Yeah.
listens and
Yeah.
looks at you.
Yeah. Yeah.
Yeah.
And so you just mentioned something very interesting about someone coming into nursing without having had those kinds of experiences. And so it made me wonder then, how much of that is mentioned or included or, or talked about in a nurse's education? Do you think enough?
I don't think so. I mean, I graduated 16 years ago and I blocked out half of that experience, that traumatic experience. But I think that's something you learn when you're in the field and you're meeting all these different people, and you have to try to find that patience for people.
Yeah.
And even
Hmm.
I lose patience, everybody does, but at the end of the day, we really have to sit back and try to be patient and see from
Yeah,
their point of view. Like, people in chronic pain, I mean, I wouldn't know what that's like. I don't
yeah,
know what it's like to have pain all
all
day.
the time.
And
Mhm.
so, of course, they're going to be grumpy. I know I would be super grumpy. So it's like, we need to just
Yeah,
stop and
yeah,
remember that.
yeah, yeah, yeah. And sometimes, it is just that something that seems very simple to us, something that we see practically every day, but it is something that someone never experienced before, and it's the worst thing that could have happened to them. It's a
Mhm.
big deal for them, and so nothing is ever really simple to the person to whom it's happening.
Yeah. And that's a lot like in the NICU with
Hmm.
babies born. And for us, it's so common. I mean, they have
Yeah,
bleed and oxygen and no big deal. And the parents are terrified.
yeah,
Just have to pull yourself back and remember who you're dealing with.
yeah. It looks scary, and it looks scary. It is scary, and they looked forward to a healthy baby for a whole 9 months, and suddenly they're presented with um not what they anticipated.
Mhm.
You
And those
know.
ones, I mean, they look like little aliens with their thin skin and
Yeah, 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 yeah. It's very hard. It's very hard. It's very hard. So April, before we go, is there any little gem you'd like to leave us with?
I think going back, one thing too
Hmm.
that we need to stop is the nurse on nurse bullying. The That's something to talk about, I think. And it's not even experienced nurses with new grads. I've seen, a nurse with 1 year experience treating nursing students like dirt, so it's like, that
Yeah,
needs to end. We need to have a culture where you can ask any question.
yeah,
If we had a culture where nurses didn't feel dumb by asking a dumb question, we wouldn't have mistakes as much.
yeah.
So I
Exactly.
always feel like we need to just allow, I mean, I still ask dumb questions. It's like, I've been a nurse 16 years, and if I don't know, I'm going to ask because I don't want to make a mistake. So it's like,
Exactly.
if you're
Exactly.
not comfortable asking, then you're going to try to figure it out on your own and you're going to make a mistake, and it's all around no good for anyone. So we need to
Yeah,
just be a team and
yeah,
stop doing that to one another.
yeah, 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 yeah. How though? How? Because as you said, it's still
Mhm.
happening. I, as I said, I've been a nurse for 49 years. It was happening then.
Mhm.
So and it doesn't just happen, it happens in every area that
Mhm.
we work. And so I have to wonder, does it go back to the stress that we're feeling, that we're transferring to, to someone
Mhm.
else? What is it that makes us so willing to be so harsh sometimes on our colleagues?
I know, it's kind of, is it your own insecurity that kind of
Yeah,
points the finger in that direction? Like, ooh, look at
exactly.
that, that
Yeah,
person doesn't know what they're doing. Well,
yeah,
maybe you don't either.
yeah,
I don't
yeah,
know.
yeah.
Look at that, that happens a lot.
Yeah, yeah, yeah. And often that you just mentioned, often that's the truth. It's insecurity.
Yeah.
Yeah. Well, on a brighter note though,
Mhm.
over all of these years, the one thing that I've found to be true and is constant is that nursing is, if you give it what it requires, is so satisfying. It is so satisfying. And I know now that there is more money in nursing. When people perceive that there is money in nursing, and I use the word perceive because I don't think that you can actually ever really be compensated monetarily for what you do.
That's
Um,
true.
but that aside, that really pales, whatever they pay you, that really pales in comparison to the satisfaction, the gratification that you can feel. And when you
Mhm.
help someone, when someone walks out of the hospital or wherever it was they were, so much
Mhm.
better than when they came to you.
Yeah. You know, I remember in the old NICU I worked in Reno, Nevada, we had like annual NICU reunions.
Yeah,
And I think I was only a few years into nursing, and you're still learning. I mean, you're still
yeah,
learning when you're 16 or 49 years, you know? So,
yeah.
but I had a parent come back and the kid was a toddler now. And she said to me, you know, April, I just never got to thank you, but you were the first one who let me change my baby's diaper. And she said, and I will never forget that because that's the moment I actually felt like she was my baby. And when
Yeah,
she said that to me, like I've never forgotten that. What a simple thing, you know.
yeah, yeah,
She was on a ventilator, she was a very sick baby, but it really changed the way that I was nursing, is thinking this tiny little action that I did is
yeah,
something that stayed with her forever and made her feel like a mom. It was like
yeah.
just an amazing moment for me as a nurse. I was like, I will never forget this.
You
And
gave
it's just
her a
a little
bonding
thing.
moment.
Yeah.
Yeah,
Very simple, but so big.
yeah. But so big.
Mhm.
And that right there is something that we need to remember all the time, that the things that we think are simple, not necessarily simple to the person that we're doing it for, too.
Yeah, exactly.
Yeah, yeah. April, thank you so much for this. I so appreciate it. It was such
Thank
a great
you.
conversation. I loved it. Thank you.
Yes, thank you. I love your channel. It's really fun seeing all the different nurses coming on.
Yeah, great. Thanks.
Thank you.